Welcome to Eye on Africa. I'm Clarisse Fortuné, and these are the top stories from across the continent. A new UN report warns that atrocities in El-Fasher may bear the hallmarks of genocide. Investigators say killings, rape, and starvation tactics were not random acts of war, but part of a coordinated campaign targeting specific ethnic groups. Zimbabwe rolls out a new HIV prevention drug targeting more than 46,000 people at high risk of contracting the virus. The country has one of Africa's highest HIV burdens, but new infections have declined significantly over the past decade. Award-winning author Chimamanda Adichie lost a child during medical care in a hospital, a tragedy that echoes cases faced by many families across Nigeria, and now is drawing renewed attention to the country's healthcare crisis. But we start with this stunning report. A UN fact-finding mission says fighters from the Rapid Support Forces carried out ethnically targeted killings, mass sexual violence, and enforced disappearances during their October 2025 takeover of El-Fasher, capital of North Darfur. The report concludes that at least 3 acts that meet the legal threshold for genocide were committed. Joy Ngozi Edzelo is a law professor, and she's part of the independent international fact-finding mission for the Sudan. She joined us now. Welcome. So first, let's go back to your findings. So what are the key elements considered as hallmarks of genocide?
Yes, so we call it hallmarks of genocide because our report found that serious violations of human rights and international humanitarian law were committed by the Rapid Support Forces. And when we found a pattern of conduct that amount to war crimes, crime against humanity, ranging from directly attacking civilians, murder, starvation, or extermination, and persecution based on gender or ethnicity. And all of these fall within the genocide spectrum. And for us, if you look at genocide convention, there are specificities and there are key elements and ingredients, and all of that shows the pattern of conduct, shows indicators that are consistent with genocide. Indeed, all of the indicators for genocide have been found, and that is what the key ones. The act identified 3, going by the Genocide Convention as well, prohibited acts that underline genocide. When killing of members of a particular group, causing severe bodily or mental harm to the members of the group, deliberately inflicting conditions of life calculated also to bring physical destruction to the group, whether in whole or in part, imposing measures that are also intended to prevent even birth within, including mass rape or forcibly transferring children and people and, and arbitrary detention and what have you. So all of that, and when you also violate the right of protected groups within that, because of course, Zagawa, the 4 committees, they are also part of the protected group that have been pronounced upon by ICC. And all of that, they were being targeted. So with the hallmarks of genocide having been established, it requires states now and states international community to take urgent action to prevent the continuing or further genocidal act within El-Fasher or even within Sudan as a whole. So it has been established, and we encourage continued international criminal investigation to further
Joy, you're talking about action, but what realistic mechanisms exist to hold perpetrators accountable?
Yes, that accountability is very important, because accountability has been part of the root causes of conflict, the root causes actually of conflict or cycle of conflict in Sudan, because people do things and get away with it. And for us, in relation to the genocide intent, once that is established, for us is important that the ICC and other mechanisms we provide, our mandate is very clear in terms of we are to investigate, establish facts, preserve evidence, identify perpetrators, cooperate with judicial entities, including ICC. And in that cooperation, when we gather these facts and establish facts, and we have interviewed even over 300 and something, even on El-Fasher cases alone, videos verified using the international best practice and the UN system. And based on that and our findings, the next step is to give those information. We give it confidentially because it's part of our work and our mandate from the UN, and then we activate those processes for accountability. As we speak, of course, ICC has mandate in Darfur, and El-Fasher falls within that. So we hope that our mission is mandated to cooperate with judicial mechanisms. And we're able to share this information of evidence we have collected so far. And then that will activate accountability for accountability purposes. And we have initiated, as we speak, confidential cooperation with those relevant bodies. And it is our mandate also to preserve the evidence that is required to take the cases further.
Your report focuses on El-Fasher, but we can see that the conflict is actually expanding to other regions, including Kordofan. Do you think there's a threat that further escalation?
Yes, there is. And if you recall, this is not our first report. We've even had conference reports on other parts of Sudan. But actually, the council mandated in November 2025, given the fall of El-Fasher after 18 months of siege, that we report specifically on Sudan, on El-Fasher. We are very, very concerned on Kordofan because we've been warning in the same way about El-Fasher and the siege. The early warnings were there, what was happening were there, and then the international community didn't act fast until we got to the stage where we are. So that is why we talk about the issue of what we are recommending in this El-Fasher report, so that they act to prevent even further escalation in other parts of Sudan, protection of civilians and prevention of further atrocities, whether in Kordofan or any part of Sudan.
Yes, let's hope that your message will be heard, because as we can see, the violence is actually still continuing. Thank you very much.
And securing humanitarian access, because really people are suffering.
People are suffering.
Atrocious crime, yes.
Thank you very much. Joan Goziedzelo, she's a law professor, and she's also part of the independent international fact-finding mission for the Sudan. Now, Zimbabwe has begun rolling out a groundbreaking, long-acting injectable that could transform HIV prevention and treatment. Administered just twice a year, the drug places Zimbabwe among only 10 countries selected for the initial rollout. Health officials say the launch marks a major milestone in the global effort to end the HIV epidemic. France 24's Sharon Mazingaizo attended the event in a suburb of Epworth, just outside Harare.
Here in the neighborhood of Epworth, on the outskirts of Harare, people have been lining up this morning to receive the first jab of the HIV prevention drug, lenacapavir. There has been a mood of jovial hope as the new injectable drug will curb new infections and expand access to care. The implementation began on a phased rollout in all 12 districts of the country. The injectable drug was researched here on the African continent and tested through clinical trials in South Africa and Uganda. In Zimbabwe, an estimated 1.3 million people are living with HIV and 1.2 million people are on treatment. Young women are the most vulnerable.
I'm very happy because this injection will prevent sexually transmitted diseases. I urge Zimbabweans to get injected so that it can reduce HIV incidence. That will lead to fewer deaths.
I came here to get the injection because I'm a cross-border truck driver. So I think protection from HIV through this newly introduced injection is essential.
The initial rollout will target 46,000 people in Zimbabwe.
If a health solution is too complicated, too demanding, or too visible, people simply won't use it. That is why innovation in prevention matters. Lenacapavir represents a new way of doing things. It responds to a simple reality. Not everyone finds it easy to take a pill every day. Life gets busy. Sometimes people forget.
The recent cuts in U.S. funding has impacted Zimbabwe's HIV response. However, this project, funded by the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the Global Fund, is aiming to reach 2 million people in low and lower middle-income countries by 2028.
Russian President Vladimir Putin has pledged closer ties with Madagascar after hosting the island's interim leader at the Kremlin. Mikhail Khandrian-Irina traveled to Moscow weeks after Russia delivered military equipment and trainers to the country. Putin called Madagascar an important partner and highlighted cooperation in sectors from energy to education as Moscow expands its influence across Africa. The visit marks one of Khandrian-Irina's first trips abroad as Russia deepens outreach to global South allies amid outgoing Western sanctions.
We want to show our readiness to develop ties with the Russian Federation in all the spheres you have mentioned, including the social sphere, healthcare and education, as well as energy, hydrocarbons, development of infrastructure, and of course, the military sphere.
A report says Nigeria's health system is dangerously unprepared. In Lagos, a clinic has launched an internal investigation into the death of one of Chimamanda Adichie's children, while continuing to deny allegations of medical negligence. The tragedy faced by the award-winning author is one that echoes cases faced by many families across Nigeria, and now is drawing renewed attention to the country's healthcare crisis. Chinwe Osundu reports.
Lagos State healthcare inspectors are visiting this private hospital in Ikeja to make sure that norms are respected. The team's department oversees public and private facilities, and a bad assessment could lead to an institution being shut down.
It is mandatory that every facility must meet the basic standards. It is mandatory. So once you are told, we expect that you meet those standards. If you do not meet them, then there are sanctions.
In Nigeria, Lagos State health sector is considered as the benchmark in healthcare delivery. Nevertheless, the recent death of the son of the writer Chimamanda Adichie in a private hospital has thrown health practitioners' work under the microscope. The novelist's family accused their medics of negligence. Their hospital denies this, but an inquiry has been launched.
Whenever a case like this happens, we are very, very focused on trying to unravel what transpired and come to the bottom of it and use it as a learning experience. And it happens from time to time, and we take every case extremely seriously.
Tens of millions of Nigerians rely on the country's 27,000 primary health centers. Esther Dabirin runs a primary health care center in Bariga, where she contends with challenges of a large population, swarm doctors, and a pressing need for more support for her team.
We have met, not all, but most of the expectation, and that's why they keep coming back. One of it is that the way we deliver care to them, we do it with an empathic front. We are empathic, so we put ourselves in their shoes. So we don't critique them when they come.
According to two studies conducted in 2025, 43% of Nigerians have personally experienced or witnessed a medical error or had a close call.
A Moroccan court has sentenced 18 Senegalese football fans to prison terms ranging from 3 to 12 months over hooliganism charges. The group had been in pre-trial detention since January 18, the day of the heated, I'm sure everybody remembers, the heated AFCON final in which Morocco lost to Senegal 1-0 on home turf after some Senegalese supporters attempted a pitch invasion while others threw objects onto the field. And this concludes this edition of Eye on Africa. Thank you for watching.